Welcome back to Meds Made Easy. My name is Tarun. Today we're going to talk about Carisoprodol, also known as Soma. This one's a really interesting medication, so kind of stick with me because I do have to get just a little bit scientific about it. It is used for muscle spasms, so it's a muscle relaxer. Generally, I've seen it taken anywhere from 1 time a day all the way up to 3 times a day. Never really in practice seen it more than that. So you generally want to kind of watch out for this medication. It is a central depressant. So the way that most of these muscle relaxers work, they don't actually relax your muscles. It's a very inaccurate misnomer. Wherever your injury site is, let's say you kind of tweaked your pec muscle or something, your cells there send up signals to your brain to say, hey, this hurts, this is not right, we need to fix itself. So what happens is then your brain tells the rest of your body, hey, that hurts, and then you get that hurting feeling, right? This medication comes in and it just cuts off that signal. And so this gives your body time to heal without you feeling pain or uncomfortable. So that's kind of how it works. Now, as your body processes Carisoprodol, it turns into another metabolite, like another compound called meprobamate. So you kind of get this dual action, which is kind of cool with this medication. You get the one that kind of cuts off the pain sensor. Once it turns into meprobamate, that really has like sedative and anxiolytic effects. Essentially just means it relaxes you, kind of like almost like a Xanax type of thing. So again, not really for muscles, but mentally it works all up here. It just really relaxes you. The Carisoprodol is in your blood system and it gets converted pretty quickly into that second compound. That second compound though hangs around in your blood for quite a while. I think the half-life is around like 10 hours for it, and so the Carisoprodol kicks in about an hour and a half to 2 hours. You really get the maximum effect of the Carisoprodol, and then at about 4 to 6 hours you get the maximum effect of that meprobamate, that second compound it gets turned into. So you get this dual action, which makes this medication very, very effective. Let's see, you can take it with or without food, does not matter, will not mess with your stomach. I was looking into pregnancy classes, that there was no evidence for it. As far as lactation goes, there is the RID and a relative infant dose, so as long as you're under that level, it is deemed safe. If you're over it, it's not, so your doctor needs to be measuring your levels in your breast milk to make sure that you're in safe levels, your baby's not getting harmed. Always, if you have any sort of renal, liver issues, make sure your doctors know about that. Here's a list of side effects up here. For the most part, you want to watch out for things like dizziness, drowsiness, headaches. If you get seizures, you need to stop this medication and let your doctor know ASAP. The big thing about this medication is the longer you're on it, the risk of the addiction potential is there with this medication. It is a control medication, especially when you start stacking it. So in practice, we've seen it a lot. It's definitely a lot less now. I think doctors have really caught on and gotten smarter, but man, there was a time when I got out of school, I was brand new, and doctors were prescribing hydrocodone, Soma, and then like Xanax, and that was kind of like a cocktail, and that's how you could get yourself like a really, really great high. And it started to get around. The DEA started calling us up and going, hey, just watch out for those kind of compounds. So I got so weary that even if I saw 2 out of 3 of those being dispensed, written by the doctor, I wouldn't fill them. It was really, really difficult. So you need to watch out because that intensifies the high and that intensifies the addiction potential of it. So if you're on opioids, you're on benzos with it, you're stacking yourself and you're going to see a bigger high, but you're also going to get a higher chance of complications, side effects, and then when you want to get off the medication, it's going to be a lot harder to get off this medication because now the drug's taking a hold of your mind. So just watch out for those guys. Those are little tips and tricks we've kind of learned over the years. If you have any questions, please leave them down below. Let us know how we're doing with these videos. Subscribe, let us know. And if you guys want to know about certain drugs, leave them down below. We'll make videos on them. That's what we want to do. We want to be able to educate everyone. So thanks for tuning in, guys. We'll see you next time on Meds Made Easy. Bye.